Hey there, friends, and welcome to Lunchtime Live with the Center, where we talk about fertility topics and answer your questions as well. My name is Ami Choksi, and October, which is right around the corner, is Acupuncture Month. So today we're talking to Helen BetGivargis, who is a licensed acupuncturist and specializes in fertility as well. She's been doing this for about 13 years, and before that, Helen was also an embryologist at the center, so she is a well-loved family member here. Hello, Helen. How are you?
Hi, thank you, Ami, for inviting me, and thank you, the center.
You're welcome.
Yes, I feel like I've been family for a long, long time, since 1984.
Oh, that's amazing. That's great. Now, before we get started, Helen will also be taking your questions, so please do comment if you have any. So, Helen, many women who are dealing with fertility issues turn to acupuncture. Can you talk a little bit about what acupuncture is and how it impacts fertility?
Sure. More and more people are hearing about acupuncture. It's becoming more of a common name in the world of holistic health, but particularly fertility. Acupuncture really entered U.S. in a more legal way in 60s and 70s. Until then, it wasn't known, and it was then more known for pain, but it is a whole system medicine. And I have to speak that language a lot because I often assist teaching it medical students. So it's a system of medicine into itself. It's over, 2,000 years old, like some think about 5,000 years in practice. The actual written medical book is 2,000 years old, and that's this book we study. So fast forward to about past 20, 25 years, a lot of attention, a lot of studies have been from Western medicine for all aspects of that Chinese medicine have been used. But first, I have to say, acupuncture is part of a whole system medicine called traditional Chinese medicine or TCM, or traditional Eastern medicine. And acupuncture is one aspect of it. We take this and we sort of study it in a lot of studies. So just keep that in mind. That's when I treat clinically, I still look, I have to do a constitutional check, like ask questions based on Chinese medicine and implement a treatment. That's always with acupuncture. I ask, what do you eat? How is your life? What lifestyle stressors are involved? There's so much more. Guidelines in terms of breath work and so much more. About the first, I focus a lot on the studies because I was a researcher when I started in endocrine fertility before I became an embryologist. And I post studies that really show beautiful results. Okay, that's what we want. We want results with everything we do. And the one that really stands out that shows how acupuncture works better is Dr. Stenner's studies in 1998 or 1999. And she did it on a group of women who were not ovulating. And it induced ovulation. It brought on periods, women who weren't having periods for months or 8 months or so forth. So that sparked a lot of interest. Like, what is it doing? So we know it works, it regulates menstrual cycle, it reduces androgenism, yes, and it does something with hormones, obviously. So then another study she did with IVF patients, and it showed, particularly women with PCOS, that shows their pregnancy rates were higher doing a series of treatments. She did it more clinically, like the way we do in clinic, 8 to 12 treatments, either weekly or 2 treatments a week. Then the other study that really sparked interest in IVF and fertility was the Paula study in Germany in 2002, where they did a treatment just before and just after embryo transfer. And with that, back then, now we have to realize the pregnancy rate in clinics were about 23%. What are they now? It's like way above. Our clinic is very high, right? It's about 50, 60%. And the group that did pre and post embryo transfer acupuncture treatment, their pregnancy rate went up to 43%. So that brought a lot of attention. That was like just that one treatment. What does it do? How did it work? So again, most studies are done and most of them show these same results. But then about a decade ago, Dr. Magarelli, who's a productive endocrinologist in Colorado, with another group of acupuncturists, Diane Kenda, they did put these together. Like, well, clinically, this is how it's done. We do a series of treatment, pre and post, and some treatment to support. And let's see how that does with a bigger group of patients. And it showed that this whole system medicine improves, again, pregnancy rate, but reduced miscarriage rate, which is early miscarriage rate or biochemical pregnancies were less in the group with acupuncture, which is very interesting. But he also measured hormonal levels, blood in the blood in women who had acupuncture and women who didn't. And there were some differences, very minute, but enough to research in terms of research to pay attention. So we know cortisol and prolactin is different in women who get acupuncture. And then lastly, my favorite and my colleague, Dr. Lee Hollander Rubin in San Francisco, she's been working with this and doing studies in PCOS, women's health, hormones, and IVF particularly. And again, because we mostly do a whole system medicine, that does better than pregnancy rates were higher in the group that did just pre and post and the group that did not do. And then, so she did 3 groups, which is a really good study. And then a group that did a whole system, which means a few treatments at least before or during the stimulation cycle, and then the pre and post, and a couple to support it. And that pregnancy rates were 61.3% versus the group that just did pre and post. And that was a year ago, which was 48%. So putting all those studies together, it shows, again, most of the studies shows that pregnancy rates are higher using acupuncture as another tool to support you.
Oh, that's amazing. So can you talk a little bit about, what happens in a treatment?
Sure. So there's always a first consult, initial consult, like in every other therapeutic setting. And with that, I do an intake and learn more about what is your whole body is altogether, because Chinese medicine is about balancing and harmonizing all the systems in the body, versus often Western medicine focuses hone in on just like the hormones, or if the knee is something is wrong. So this is the whole system. You want to bring it in balance, because just that's the core of the system. It's not, I'm not fixing the uterus, I'm bringing all the system in a state of balance. It's
Okay.
so then I do a treatment after the intake, okay, which needles are put often below the knee for fertility. Even though I usually use less treatment, the styles I've trained many styles, but like Kiko Matsumoto, which is Japanese style, or 5-element, which is very gentle. But with fertility, there's more needles than less. The needles are hair thin. They're like, and I would call them antennas, that they fine tune your whole system.
Okay.
And it's based on that there's pathways of energy along the body, just like your vascular system and your endocrine, your lymphatic system, that these pathways we cannot see with the bare eye. That's the philosophy of it. So I can't prove that scientifically, of course, but that acupuncture is put along these meridians to fine tune the system that are mirroring deeper levels, like the whole liver system has its own, the kidney system and fertility has its own, the lung, large intestine, the stomach, spleen, the lungs, but all of this have to be harmonized. So when I check the pulse, look at the tongue, and sometimes do abdominal palpation, and from the questions I ask, then I'm like, okay, are we talking from Chinese medicine diagnosis? I put something together, and based on that, I treat you. So you may be treated different than another woman who comes with both same Western medicine diagnosis of, like, let's say, poor ovarian reserve. So then you lay on with a soothing music. I often use other aspects of Chinese medicine, guide you through a meditation or a microcosmic breath work, which is a really nice qigong breath work, and then leave the room and let you rest. And some of us call it let you cook. And then often people relax even in the first treatment. By second treatment, people fall asleep. And then that's the first treatment. And then follow-up treatments are similar, a little bit shorter. The first treatment is a little bit longer, of course. Treatments are cumulative. And that's definitely from Dr. Stenner's studies show that after a series of treatment, like the cycles harmonize. However, I have seen, and I've come to this conclusion after like years of being in this, sometimes we are just a little bit out of tune. Sometimes maybe we're a lot out of tune. Sometimes we maybe need that vacation and we go and we come back and we get pregnant. Sometimes we need that couple of treatments of acupuncture. Sometimes we need to leave our job. Who knows? It's like that. I feel like acupuncture works like that too. Often, yes, a series of treatment will help, but sometimes even a little bit may normalize what was out of balance.
Now, Is acupuncture good for any diagnosis with regards to fertility?
Again, acupuncture, it goes by Eastern medicine diagnosis, but if I have to translate it as a scientist to Western medicine, yes, again, we're bringing the body into a state of balance. Often we find women with unexplained fertility, with poor ovarian reserve, with poor responders do really well, and PCOS do really much better than younger women using acupuncture. That's not to say younger women shouldn't be using it, but I'm saying particularly if there's issues and with unexplained is like we don't know what it is. Everything looks good.
Yeah.
And that's why same with like if I had to like chronic issues work really good with acupuncture and Chinese medicine because there's systems that we don't know.
Okay. Yes, and you see that we have a question regarding specifically unexplained infertility, and if there is, is how's acupuncture helpful for women going through IVF with unexplained infertility?
Yeah, again, I go to the core root of Chinese medicine, which is we are bringing your body to a better state of homeostasis or balance. Homeostasis is a very scientific term, actually. And balance is I know it's a cliche often, but that's what the core of Chinese medicine. It's like that. It's like that. You wake up in the morning and you know something is off. You're not sick, you're well, but your energy isn't quite there. You're like, oh, today I really should drink more water. Okay. Or maybe today I should take the day off and just go outside in nature. So what you're doing, you know your body's a little bit off and you're doing something that you think will support you. Or let me today, past few days I've been eating really unhealthy. Let me today I make sure I'm eating well and feel better. Or I need a little bit more sleep. Next few days I'll make sure I sleep well. So again, innately we know when our body is out of balance, but Chinese medicine does it stronger. Am I off? It's stronger. It's like a stronger medicine in terms of these needles are put in. It works through the central nervous system. That's how we are finding out more. So it normalizes the HPO axis, which is hypothalamus pituitary ovarian axis, and HPA axis, hypothalamus pituitary adrenal axis.
Okay.
And we know that it normalizes cortisol. So that plays a lot of roles in all the cascade of hormones as well. I hope that answers.
Yeah, I think that's great. So now you said they're really thin needles. So is there any pain involved?
Yeah, people ask that often. They are hair thin. Like if you look at your hair, it's like it's that thin. Often you can't see them. I particularly use a gentler needles and gentler treatment called based on Japanese style of acupuncture. So they're much thinner and you may feel a little mosquito bite sometimes. Most of them you actually don't feel, which is fascinating. Sometimes you may feel a little pinch and if it should go away. It goes away as soon as you're putting it in. Okay. And it barely goes under skin. I'm tapping it. It's very tiny. Unless I'm working on sports like injuries and then bigger muscles of like, let's say hips, then I'll use, longer insertion. But otherwise they're pretty shallow. Once they're in, you're really go in a state of relax. I rarely see someone doesn't like it. And if that's the case, I always say, and they're like, no, but it's good for us. I'm like, don't do it. If it's hurting you, don't do it. But it's like in the 15 years of, let's say 16 years together, I've been treating patients, maybe one patient. And I encourage them, like, go get a massage. You're too tense for this. It's okay. But it's
so calming. I have to say I've had it done and I just think it's just so relaxing and calming. And when you're in a regular state of stress, if you're dealing with fertility issues and you're feeling anxious, it is so calming and it just makes you take a break and take a minute to relax as well.
Yeah, and that's another piece that often we used to say, oh, acupuncture maybe is just relaxing you. It does. Yeah. And I believe that's why, because I've been thinking as a scientist, why is it pre and post even just that showing good results? Whereas, it usually takes a little bit. It's like me telling you, you have a marathon tomorrow, have a good breakfast in the morning. And you're like, well, should I eat good breakfast every day? I'm like, yeah, sure. Prepare for a good month for it and sleep well. But I almost lost the state of this train of my thought. Let me
You were just talking about being relaxing.
Yeah, they're relaxing. So the pre and post, I believe, because having been an embryologist since 1984, and when we would be, bringing the embryo back to that day, women get so stressed out, and for good reason. As more I sat with it, it's like it's a day that finally the embryo is put back. It's a lot of weight on a woman, on a woman who's like, okay, now it's all on me. Until now, we're like working together, sperm and egg, we're together. If anything, still there's going through, and then suddenly the embryo is going to be put back. So it's a lot that day. So anything you can do to, calm your nervous system, it's good. But we're also finding that there's a study that showed it calms the uterus gets gets contractions. Okay, so it really reduces uterine contractions,
I see.
the pre and the post treatment. And it also brings more blood flow. The uterine artery pulsatility increases, so there's more blood flowing. The uterine lining increases because of that. And that's for, let's say, just transfer we're talking about. But definitely relaxation is a big piece of it too.
You're talking, you mentioned that it's great for the women for pre and post transfer. Do you ever see men with regards to this as well? Can it be helpful for men as well?
Yeah, there's many studies support that improve motility, the motility improves a lot, and the volume with acupuncture. And there's many. Overall, men tend to not seek acupuncture for their fertility. That's interesting. But often I see at first the partner comes and gets some treatment, and then slowly she brings her husband if he has issues. But sometimes even if they don't, she brings him to just, again, to optimizing his health, because at the end it takes two. It really takes two. And I attend often almost every year the Integrative Fertility Symposium in Vancouver, and many speakers come. And the last few years there have been a lot of emphasis that we forget about sperm because we're doing it's like, okay, we're just going to be injecting it. It's like, no, you still want a highly healthy sperm to go into your egg, because then you'll have a very optimized healthy baby. Even though it's being tested, the men shouldn't be off the hook.
Okay. Now, you had talked a little bit about a series of treatments. So, how often, when should it be done? Is there a good number to start with? How does that work?
Again, I will say first, I meet you where you are, okay? Time consuming, and it involves more than that. So even getting one or two treatments is better than not getting any treatment. Having said that, as soon as you're doing work for fertility, you're at the center, or incorporating other things like, oh, I should eat healthier, let me see what supplement, and then start adding acupuncture. Get the first treatment at least, get the initial consult, so you're on the road, okay? You know what things to look for, what things to do, you have some tools, and you get a treatment. Do I like it or not? Maybe it's not for me. Or am I compatible with my practitioner? That's another important piece, like we're working well together. And then I always give a treatment plan, and then you decide, do I want to come, like if the IVF is in 6 months, I'll get a few treatments, and then as it gets closer. Ideally, I actually looked at a study yesterday from Australia that pulled all this together. And it says you want at least 3 treatments is the minimum you should get. And if that's pre and post, and one should be during your stimulation cycle. A study actually showed less than 3, it's at a place that you want to get at least less 3. And then ideally more than 3 does better. Okay. And anywhere, like for PCOS, it says 16 to 18 treatments. For usually norm in all fertility clinic is a 3-month cycle. And often it's called once a week to come. Some practitioners do 2 treatments a week. I often stay with 1 treatment a week. And so it's with 3 cycles, we know we can change things. Because we won't know until the next cycle begin how, especially if women are having, I had less cramps, or the bleeding wasn't as heavy, or I don't bleed, I only bleed very light, but now with the acupuncture, I'm bleeding normal like when I was younger. So these are all signs that I know we're in good track, we're making slow movement.
Okay.
So the basic of it.
So you talked about pre and post. So during stimulating the stimulation, stimming, and then right after a transfer as well is helpful. And what about that 2 week wait? Is that a time to do it as well?
Yeah, and that's where both Margaret Holland or Rubin studies both show that early, what I call it tender first few weeks, that acupuncture shows it reduces biochemical pregnancies, it reduces early miscarriage. So, and again, the reason is because it's bringing more blood to the area, it's relaxing you, okay, all of those, and normalizing any fine tuning, any small, minute ways of balancing the system, which is the endocrine system, the
Right.
hormonal system. And that's actually studies that showed, Magarelli showed, along with increasing pregnancy rate in the group with acupuncture, there was less miscarriage.
Okay. And now, and going back to how it works, are your clients on their back? Are they on their stomach?
I do
Make
both. Again, depending, each treatment is based on when you come in. Again, you're constitutionally, and by now I know what's your constitution, what points I should always use, for example, for you. And then based on where you're on your cycle, I will tailor it. Sometimes it's like, well, treatments are face up, a lot of points on your lower abdomen, sometimes face down, particularly the area on the back of the sacrum is a very powerful place of treatments that
okay.
I use, and the mid back and back of the head. There are some points back of the legs, but and that's why, like, doing just a regular abdominal massage or massaging your back is actually, just do it. It's a good idea. It's like you're bringing more blood, you're bringing more vibrancy there.
Yes. Yes. Okay. So it all depends on the person and it all depends on the intake.
Depending on the person, the time of the cycle, where we are in, whether we are doing IVF or where we are in those stages. All of those are a factor in how I'm going to be treating you that day.
Okay. And is it take a certain amount of time? Is it an hour treatment cycle or treatment?
Treatments are about an hour, yeah, about an hour. So I do an intake, then start putting the needles, guide you through meditation, and then leave you there, come check, and then take the needles out. Do you have any questions? And then you go.
And is it typically covered by insurance?
It's typically not covered by insurance because most insurances still in state of Connecticut are not covering it. There are some that they say they cover acupuncture. Just look at between the small lines, as they say. There may be a deductible. Often, like with Blue Cross, I know it says like they may look. Often they don't cover fertility, but they may cover, like, often they cover pain, osteoarthritis, migraine, knee pain, and nausea from chemotherapy and nausea from pregnancy. So then, because I continue treatments throughout pregnancy on less intervals, of course, I mean, longer intervals, and nausea is one of the things, and they cover it. But in my practice, you pay up front, I give you a form with ICD codes, you submit it, and they give whatever that they would give. One thing I want to say in terms of acupuncture is education, that it's 3 years at least long. And since I graduated, there's not a year that I don't take courses, particularly with specializing fertility. So you want to go to someone who's licensed. There are a lot of well-meaning chiropractors, naturopaths, and that do acupuncture, but most often they just study that 300-hour course online, and they don't know the whole system medicine. It's a very intense, broad system. Particularly for fertility, you want to see someone who's at least have studied, they're licensed acupuncture.
Well, I know that you take a lot of coursework, and are well entrenched in the world of fertility and acupuncture.
Yeah, and also, again, that's not to say those acupuncture treatments aren't good. It's just you want a complete system of treatment for what you're doing, particularly. And the other thing is there's a whole movement in physical therapy that are using needles but they shouldn't be calling it acupuncture. They're just doing it for muscle release. And
Oh,
that they're like, in terms of safety, we're having some problem with physical therapists. So that's one thing you don't want to use for fertility. That
okay.
a licensed practitioner is what you should be looking for, at least.
Okay. Now we have a couple of questions. One of them is Meg says that she doesn't live in Connecticut anymore. Do you know of any practitioners in the Philadelphia, Delaware area? I know you know a lot of people, especially in the Northeast.
What I would say, I actually don't know many in Philadelphia, but I can look in the circle of my fertility expert to see who they are in Philadelphia. If you email me, I can send you information. One of the things you want to look for is that they do fertility treatment, that they are also aware of the Western medicine aspect of it. They're well versed, because it's important to be able to talk about it and know that whole world, that whole concept. Often you want to look, ABORM is one, like there's a licensing for fertility specialists that later they made it in all the courses that we took, then they created ABORM as like a specialty.
A website where there's a list of practitioners that might have that specialty that they could look at?
If you look at ABORM, ABORM, okay,
Okay.
the thing we've put together along, my teachers. I was an embryologist, so I don't need to do that route. But and I would ask if you can email me as well. Me, if I find more, I will give you more information. But if you look under ABORM, you will find more fertility experts under that.
Okay. What is your email address?
It's Helen at acupuncturetreeoflife.com. Just
Okay.
like my website is Acupuncture Tree of Life, then Helen at Acupuncture.
Perfect. Another question, is this done at the center? And I can answer, I can say that yes, for pre and post transfer, it can be done at the center. But Helen,
Yeah.
you're also so close by as well.
Yeah, the center, once they put it together, they moved and we work together, where when patients request that I come there at like 2 minutes, not even from the center. So most patients actually come to my office because it's very relaxing. There's a nice music and they get into that mode. And some patients, particularly those who travel and they're coming from far, they come there and they're like, oh, can I get the treatment? Then we plan it ahead and I meet them there, do the treatment, and then wait until the transfer is done, which is really often fast, and then I do treat them right after, and they don't have to change or anything, and then.
Oh, great. Okay, so another question, if insurance does not cover acupuncture, about what is the price range for each session?
Sure. The basic initial consult is $140 and follow-up appointments are $100. So
Okay.
that's the basic of the fertility.
And you,
Other works that I do and I bring, there's other factors, but that's the basic. That's how I treat. And most of my patients are fertility, so that's what it is.
do you take HSA accounts, those
Yeah.
type of health spending accounts? Okay.
Yeah, you always think that, no problem.
And sometimes you offer like I forget what they're called, a super bill for patients.
I always give them, yeah.
Okay, great. So Tara says, I find it very calming and relaxing, and I feel it was a big part of us having a successful transfer. That's lovely.
Hi, Tara. Yes, there's a beautiful girl.
Wonderful. Helen, thank you so much for sharing your wisdom today.
Oh, thank you, sir. And thank you, everyone, for being. Good luck, everyone. May you all have a fertile life and beautiful.
Oh, wonderful. Well, we'll be back next week for another Lunchtime Live, and be sure to check our website, yukonfertility.com, for a calendar of events from support groups to yoga to these live informative sessions as well. So we just want to be able to help you and support you and stay connected, because this can be a challenging time. So anyway, have a great day.